In this lecture, we're going to discuss Chapman's points, and unfortunately, it's another memorization lecture. Instead of showing a chart, I'm going to demonstrate how I was taught how to draw out the Chapman's points. It's the only thing that worked for me, so I'm going to teach it for you. A Chapman's point is a 2 or 3 millimeter papule that represents a viscerosomatic reflex located on the anterior or posterior side of the body. What they are used for now is really to help aid in diagnosis and not necessarily for treatment. So we're going to go ahead and demonstrate how to draw these things out. So we're going to draw some clavicles and then 12 ribs and draw out our midline. So there are a couple points located around the clavicle and rib line. You have the ear, the nose, and the pharynx. Next, we're going to move into the inner space, where you have the tonsils, the larynx and the tongue, and finally the sinus. So the next points are going to be outlined in the rib interspaces. So you put a point here, 3 points here, and then points going all the way back up. You can number your ribs so you know which rib interspace you are in. To help you keep these straight. This first dot in the second rib interspace is for the heart. Continue to move down, and this one's for stomach acid. The next is for stomach motility. And then you have the spleen. Moving over, you have the pancreas, the liver and gallbladder, another point for the liver, the lower lungs, and the upper lung. This final point is almost a grab bag. You have the thyroid, you have the bronchus, you have the esophagus, and the myocardium. To finish off the points on the anterior side of your ribs, you can place 3 points like this. These 3 points, bilaterally, are going to represent your small intestine. The next set of points are around your belly button on your abdomen. So this will be your belly button. 1 inch lateral and 1 inch superior, you have another point, and 1 inch superior to that is another. These represent the adrenal gland, the kidney, and the area around the umbilicus is for the bladder. There are some Chapman's points located in your pelvic area. So imagine this is one of your innominants. You have a point at the pubic tubercle, which represents the ovary and the urethra. And another point located more inferior that represents the uterus. The next points are going to be located on the anterior side of your thighs, and they represent the colon. So we all know how the colon runs, where you have the ascending, transverse, descending, and sigmoid. Just imagine that and flip it over on itself, and that will represent the locations for the colon Chapman's points on your thighs. So if we're going to draw this out, it will look like this, where we have the cecum, the descending colon, portions of the transverse colon, going back over to the sigmoid, like so. And then imagine that our thigh is right here, and this is the rest of the foot to demonstrate. There's another point back here for the prostate. That's going to be located on the posterior side of your thigh. There are two other random ones that don't really fit into the organizer anywhere, so we're going to have to write them out. So the coracoid will represent the cerebellum. And finally, the most random point of all of them, on the lateral superior humerus, that's going to represent your retina and your conjunctiva. So this is how I was taught to remember the Chapman's points. I hope it helps you remember where the Chapman's points are as well, instead of having to memorize the chart. Where we talked about the anterior Chapman's points located in the rib area, if you can see, it kind of makes sense as you go from the superior side of the body to the inferior. You have a group of ENT, then you have the heart and upper lungs, and as you move further down in the body, you're going to reach the stomach, the liver, the pancreas, and the small intestine. Everything over here is the more difficult stuff to remember. And that's OMM Chapman's points.